This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Atrofine injection is a vital medication that plays a significant role in emergency medicine, specifically for restoring heart functions during critical situations such as cardiac arrest. This injection is also utilized in surgical settings to manage salivary secretions and counteract bradycardia while providing effective treatment for specific types of poisoning. Its mechanism as an antimuscarinic agent allows it to block the neurotransmitter acetylcholine, resulting in increased heart rate and reduced bodily secretions. Indications and uses. This medication is indicated for various medical situations, including restoring normal heart rhythm in emergencies like cardiac arrest, serving as a preanesthetic agent to decrease salivary secretions, and reversing the effects of muscle relaxants used during anesthesia. It is also effective in treating overdoses from certain muscle relaxants and acts as an antidote for poisoning caused by specific substances such as insecticides and mushrooms. How it works. Atrofine injection functions as an antimuscarinic agent, effectively influencing the body's physiological responses. By blocking the action of acetylcholine, this medication stimulates muscle activity, increases heart rate, and reduces various bodily secretions, including saliva, sweat, and bronchial secretions. This unique mechanism aids in restoring cardiac activity during emergencies and alleviating excessive secretions during surgical procedures. Directions for use. Atrofine injection should only be administered by qualified healthcare professionals through various routes, including intravenous, intramuscular, subcutaneous, or via an endotracheal tube. The dosage and duration of treatment will be tailored to the patient's individual needs based on their age, body weight, and specific medical condition. Possible side effects. Common side effects that may occur include dry mouth, blurred vision, rapid heartbeat, constipation, and confusion. If severe symptoms or allergic reactions manifest, immediate medical attention should be sought. Precautions and warnings. It is essential to exercise caution when using this medication, especially in patients with a history of heart disease, kidney or liver disorders, or chronic pulmonary conditions. Pregnant and breastfeeding women should only use it if deemed necessary by a physician, ensuring that the benefits outweigh any potential risks. FAQs. 1. Can this injection be used for emergencies? Yes, it is effective for restoring heart rhythm during emergencies. 2. What precautions should I take? Inform your doctor about any pre-existing conditions and stay hydrated. 3. Can it be administered via trachea? Yes, under medical supervision, it can be given via endotracheal tube. 4. Does it increase heart rate? Yes, it is designed to increase heart rate during emergency situations. 5. Can it be used in infants? Generally not recommended without careful consideration and dosage adjustments. Thank you for watching. If you have any questions or suggestions, please leave a comment below. Your feedback is valuable to us, and we appreciate your engagement.